Monday, August 26, 2024. This is our second morning work session. This particular one is focused on behavioral health services, and we'll have a conversation about the process for determining potential grantees for the Community Impact Grant funding. My name is John Kafalis, Commissioner from District 1, joined by my colleagues, Kristen Stevens from District 2, Jody Shattuck McNally from District 3. We have our County Manager, Lorenda Volker, and we have other folks in the Commissioners Conference Room, Lori Kadrich, our Assistant County Manager, and Laura Walker is off to the side there, and she is our Director of Human and Economic Health, that service area. So with that, Lorenda, do you have anything wise to help cue us up? Or
I guess I'll just say each year we do an application process as a county for the Impact Fund grant applications. And I understand this year a record number were received yet again. We keep breaking that record. But there's a process for evaluating those, for reviewing those, and for making recommendations to you. So staff will talk to you about what that process is, how many applications we got, and what their recommendations are that will come before you for approval.
Good morning, colleagues. Just want to thank you for the opportunity to be here this morning and share the process that we've undertaken for our next cycle of recommended grant awardees. I'm Amy Martonis, the Director of Behavioral Health Services, and I'm pleased to invite my colleague, Jessica, to take over and share her exceptional work in overseeing this process.
Thank you. Hi. I'm Jessica Plummer, and I'm the Program Manager for Larimer County's Behavioral Services Department, and I oversee our Impact Fund grant program. So I'm here today to share with you what those recommendations are and to walk you through the process of how we got here today with those recommendations. So on the agenda, you can see we're going to walk you through the evaluation process. For the commissioners, this is something that you've actually seen year over year for the last several years. That process has not changed very much. For folks tuning in for the first time that might be online listening, thanks for being here, and hopefully this is good information for you. We're going to go through the application and recommendation overview, and we'll talk about some data and trends that we're starting to see over time. I think Lorenda already talked about this. We're seeing record numbers apply every year, and that dollar amount for requesting funds continues to go up every year. And then we will talk through the funding recommendations by award type. And so we have different targeted areas of focus, again, which haven't changed in the last 3 or 4 years, but we'll go through those when we go through the recommendations. We'll talk through any questions and ask for your advice on any next steps. So first, when I talk through the process, I know this slide is very difficult to read. It's small. This is why we have it printed for you, and 11 by 14. And so if that's easier to read, I'd recommend looking at that large printout. For those online, I apologize. It's a little difficult to read. But I'll walk you through what this matrix is and how we go through our award process. So just to kind of backtrack and remind everybody, this is an annual grant process. And so that application period opens June 1st and it closes June 30th. And so what you can see in the top left-hand corner is that first week of July, we go through our pre-screen process. And so we go and look at all the applications to make sure that they are complete. So on July 1st, we're already starting the review process, making sure the applications that have come through are complete, the documents that they've uploaded are correct. And then we follow up with any organization that may not have uploaded the correct documents. Sometimes there's they upload a duplicate of the same one by accident, so we just make sure that nobody gets left behind that tries to submit. And so we want to make sure that everybody that applies can make it through the process. So we do follow up in that first week or two to make sure everything is complete, and we have a couple just background screening checks during that that pre-screening process before we can move on to our evaluation, which is, there's 4 types of evaluation. This is posted publicly on our web page, which is alignment, capacity, context, and impact. And so alignment just means alignment with our ballot language and funding priorities, as well as the capacity to take on the work. So looking at organizations' financials and to be able to carry out the work that they've proposed. And so staff in the Behavioral Health Services Department helps to make sure that all the grant applications that have been applied for do fit our ballot language and our funding priorities, and if so, maybe part of our targeted areas of focus. And so there's a scoring rubric for that. We have financial reviews as well. So organizations are required to upload a lot of their financial information for us to evaluate and see if the work that can be proposed can be carried out, as well as looking at whether or not they conduct any evaluation, any efficacy of their work. So that is part of the initial review. And again, if they are a previous grantee, they also have a prior grantee compliance review to make sure that they are continuing to be in compliance with the funds that they've received previously. So once organizations, if they can be funded through that, they move forward to our subject matter expert review panel. And if you can see on the left, this increased by 5 this year due to the increase in the number of applications we're seeing. We added an additional 5 reviewers to that committee this year. So a total of 22 external grant reviewers. And that review committee is made up of a diverse representation of community members that have different levels of experience, particularly in areas where we look to have targeted funding. So experience in some of our targeted areas, so they're able to evaluate on those criteria. And so with those, they evaluate on context. So what is the proposal's context in the community, and what is going to be their impact if they are awarded. And so they are provided with a scoring rubric as well to evaluate on community context, where they fit in the community, collaboration, whether or not the application is just a request for their own organization, or are they collaborating with others across the community? Are they doing anything to improve health equity? Is the proposed program, if it's funded, is it proven, or does it have the possibility of success? Meaning there's a lot of other factors to make sure that programs are successful, and funding is just one of those. And so if BHS can provide the funding, are they likely to be successful? And what is the impact for the cost? There's a wide range of applications from, training and that can reach, 10,000 people for prevention education, to things that are more specific, a deeper dive into folks that have maybe frequent utilizers, that have maybe a higher touch program. And so looking at impact for the cost for some of those programs. So and to give you a little bit more context, so we had 84 applications this year. We had 77 of those make it through to the subject matter expert reviewers. And so each application gets 3 reviewers, and those are scored in each one of those areas on a 1 through 5, and those scores are averaged and brought to our executive review committee. And with the 22 reviewers, that means 231 reviews were done this year, a total of about 173 hours of folks' time, because we surveyed, and they spend between 35 and 45 minutes per application. Each reviewer gets about 11 applications to review, and so they spend about 8 hours, just under 8 hours, reviewing those 11 applications. So it's a lot of time and effort that is put in by folks who are volunteering to be part of that subject matter expert panel review. Once it goes through that review process at the end of July, they have 2 weeks to do those reviews. It goes to our executive review panel, so we have 3 people slated on that to help build the portfolio. So what generally happens is when we get $7.4 million in requests, it goes through these rounds, and we have more recommended for funding than we actually have money to give, unfortunately. So the executive review panel has the difficult job of being able to prioritize what's been recommended and taking input from all those previous rounds and trying to make some funding portfolio recommendations. And so even though that they might have been recommended for award, subject matter experts have, suggested maybe some be partial awards or things like that. So all those notes are taken into consideration. And the executive review has a week to review all those. So I believe 74 applications made it through to that point, and they were reviewed, and each executive reviewer has the task of kind of building their own portfolio and making recommendations towards the $2.8 million that we have available. Today, we're going to be asking for $3 million, and I'll get to that in a little bit later in the presentation. And so then they bring their recommendations, there's consensus, and we come together in an in-person selection day and try to make final determinations on those recommendations for award. So this year we have, and we'll see on the next slide, there's going to be 41 awards being recommended for this year for a total of $3 million. Once we did that in the first week of August, we brought those recommendations forward to our Behavioral Health Policy Council. And so those recommendations, that packet was reviewed with that group last week, and those were forwarded along to you guys today for your review and then hopefully approval at the Administrative Matters meeting next week. So down at the bottom of that matrix is our decline process. So if the organizations didn't complete their application, which one did not this year, and a couple were ineligible, they were declined at that beginning part. If they do not meet the ballot language, so one was screened out because it wasn't behavioral health focused at all, and others had some high risk. There was a couple that were screened out at that point. And then if all three subject matter experts said, hey, we don't recommend this to move forward, then it also was removed from consideration. And so what we're kind of looking at next year is how we can incorporate some part of that process into notifying applicants where they are and if they're moving forward or not, because we want to be good partners to these organizations that are waiting 2 months to find out whether or not they're getting funding, and see if there's a better way to notify them earlier and ahead of time so they can make plans for the projects that they have moving forward. So again, this is kind of what I talked about as we were going through the last slide, but again, we received 84 applications this year. 81 of those passed through to our initial review. Through our initial review, 81 applications were reviewed and 77 passed through to our subject matter experts. Our subject matter experts reviewed 77 applications and 74 passed through to executive review. And then our executive review panel got to review 74 applications, and 41 of those are being recommended. And that's what we're bringing forward today. So again, just another overview. 84 grant applications from 82 unique organizations. We actually had 2 organizations this year apply for 2 separate grant applications, which we do allow for if they're completely separate kind of proposals. And so we received $7.4 million in requests for the $2.8 million that we have currently approved. And so we have 41 applications for $3,426 recommended for award today. And so our current approved budget allocation is the 2.8. Behavioral Health Services is requesting a one-time increase of $200,426. Most of that funding we have because BHS received about $155,000 back from a previous grant cycle and are requesting those funds to be redistributed this grant cycle along with additional $45,000. So BHS has the funds. We're looking for approval to be able to move forward with that increase for this year, just a one-time. I think it's always good to have a little refresher for the award history of where we started and kind of where we are today. We don't have to spend too much on this slide, but after the award recommendations are approved for this year, that'll total $14.7 million that have gone back into the community, starting in 2019. So in 2019, there was invitation round to get grant awards out the door really quickly, so $1 million, and then you can see how the allocation has increased to $2.5 million and then $2.8 million in 2022, and how we're just recommending a one-time increase for 2024. The other thing I want to point out about this slide is that I'm going to talk about some data and trends, and just want to point out that 2019 and 2020 were a little bit different years in terms of having an invitation round and then carving off some funds for the crisis response funds that we did in 2020. And then with the start of our targeted project areas, which were defined by our advisory groups in 2021, the data that we have to compare apples over apples year over year starts in 2021. I just want to make sure that that's clear because those years were just not really easily comparable year over year. So that's why when we are looking at the data and trends, it'll be from 2021 through 2024. So as we're looking at the application data and trends over time, we're seeing from 2021, 4.7 million, and it was around 4.5, I believe, the year before that. So we're seeing a huge increase since 2021, and the biggest increase was last year in 2023. The amount requested has stayed fairly consistent. The median amount, it's fluctuated a little bit. But we can see that the number of applications has also had a huge jump since 2023. And the number of awards has stayed fairly consistent because the amount of funding that we have has also stayed fairly consistent. And there's only so many grants that you can award with the amount of funding that you have. And so because we're getting more applications, we're having more declines. So starting with last year was the first year that we declined more than we awarded. And that trend is consistent with this year as well. In an effort to try to fund more organizations, because there's so many worthy organizations doing such great work in the community, the number of partial awards continues to be there, just because there's so much good work happening in the community that we can't fund everybody in full. So other application and award data trends over time, the number of new applicants we're seeing, so those applying for the first time, we are still seeing an increase, which ties into the amount of new applications that we are seeing. It's hard to get in. There's only about 25% of the portfolio that is a new grantee year over year. We're seeing, or 15%, we're seeing that we're funding roughly a third of the continuations, a third are new programs, and a third are new organizations. And so I'll define those a little bit on future slides, but basically they're new grantees if they've never been funded by behavioral health services before. They are a new program if it's an organization that we funded in the past, but they're applying for something different than what we've funded previously. And a continuation is for BHS to fund something that they've already funded and currently funding. So the next slide is more award data and trends over time. This is in regards to our targeted areas of focus. So these, again, are some things that were established by our advisory groups in 2021. And so those were the areas of care coordination and system integration, workforce expansion and support, alternatives and interventions in criminal justice, services in diverse settings, expansion of child needs services, and then we have a responsive category. And as our advisory groups had advised us earlier this spring, we want to make sure that at least 70% of our funds are going to these targeted areas, but that we still want to leave some room for those responsive grants that may not fit into those specific targeted areas, but we know are doing important work in behavioral health in the community. And so I guess the two things that have little stars next to them are seeing an increase in services in diverse settings. We are seeing a lot of alternatives there with, and I guess it kind of coincides with the workforce expansion and support. We're seeing a decrease in workforce expansion and support, although that seems to be embedded in a lot of other proposals that we are seeing anyway. But in terms of funding full-time positions, it's really hard with one-year grant funding to be able to support workforce with these time-limited funds. But we are seeing a huge rise in peer support and a lot of non-clinical supportive services that are meeting the needs of folks at different levels of care through services in diverse settings. And that could be anything from equine therapy to peer support. And then I guess we're currently down a data person right now, but we do have some work to do as defined by our advisory groups to look at the secondary impact target areas to help inform the next grant cycle. So we know that when folks are applying, this is their primary area of focus, but we know, for example, there's an organization in child and youth services that has a fellowship program that's part of it, but that's not in the workforce area here. And so it's hard to capture, I guess, in this simplistic view of some of the areas that have overlap that we know address more than one target area. And so we're going to take a look at that and try to do a better job about how we're going to capture that and identify that moving forward. But right now, this is how organizations are self-identifying what area they fall in based on what they're applying for. This is a sample of just some other primary impact areas and secondary impact areas we've been kind of taking a look at as folks have been applying. This was some data taken from this year's applications where a lot of them, which, makes sense. We have the biggest area that we tend to fund is in the area of youth services. And so a lot of those tend to fall into that bottom category there of protecting against risk factors for poor outcomes. And so, again, without kind of a data person right now, we have some of this information. We know we can collect some more of this information, and these are things that we're going to be looking at moving forward is not only those target areas, but these primary impact areas and looking at other secondary analysis of other impact areas so we can quantify those and demonstrate that in future awards. So this is the snapshot overview of the funding recommendations for this year, where you can see that where the applications have come in these areas and where we're recommending for award. So you can see that through this bar chart, expansion of child and youth services seems to pop out. It's the tallest one. There's 34% of the portfolio is being recommended for award in that category, but you can see that there's a lot of applications in that area as well. We see kind of that second area in that services in diverse settings, as well as care coordination and responsive, but less in terms of the alternatives, interventions, and criminal justice and that workforce area. Again, one of the things we wanted to point out is that that workforce component is embedded across some of these other programs through training and development for a lot of their organizations and their staff. So it just might not be the primary piece of their proposal. Does anybody have any questions before I keep moving on? Yes.
Yes, Commissioner Stevens.
Yeah, so it looks like, there were applications for about $500,000 for workforce expansion, and those didn't make it through the process. So, not questioning that at all, but how do we, if this is a priority for us, how do we solicit applications that are good to get through the process and that achieve this goal, knowing that many of them may look a little different? I think that you said that workforce is embedded in things, and I think with trainings and that kind of stuff it is, but is it ultimately increasing the workforce? Potentially not. And so I guess I would say, how do we get more of those kind of applications that are good applications that we want to fund? Because we want to increase the workforce. And so what does that look like for the future?
Yeah, I'm happy to share some thoughts about that. I do think what Jessica has identified in terms of workforce development being embedded across these other awards is significant, and we recognize needing to strengthen the way that's reflected by identifying secondary areas. Some of these awards do include scholarships or internship stipends, areas of workforce development that aren't reflected in the way they're currently categorized. And part of our discussion and thinking forward has been what could we build into the process for FTEs or workforce positions to be sustainable over time, where they're not limited to that one-year funding, but inviting that kind of thinking on the front end of how will this move towards a sustainable workforce model across the organizations. But as we get into some of the award recommendations, perhaps we can highlight a few of the more substantial awards that include some of these workforce components that just aren't reflected here. So we will continue to give thought to how we collaborate with our partners around longer-term advancements and increases in our behavioral health workforce as a priority.
Yeah, that'd be great, just because it seems like an area where we're not having as much luck as getting those kind of programs off the ground, and knowing that they're extremely essential, and especially from what I hear at least, people who are Spanish-speaking and people who have those cultural competencies to do work in different communities. So, yeah, just, kind of curious about that. And if they do cross line some of these, how can we better reflect that sort of in these graphs? Because I think we are doing some of that work. And can we, I don't know. I mean, I guess I just, if we have this as one of our priorities, one of the buckets that we want to fund, how can we get at that better?
As Jessica gets into sharing some of the recommendations further, just to share that there was a recommended award for a bilingual staff person and for hiring clinical personnel with underrepresented identities built into some of these other components. So aligning with those priorities as you were naming them.
That's great. Can I ask one more question, too? My other question was, when we're talking about, and this is kind of going back to the evaluation process of the subject matter experts. First of all, how do we get reviewers that aren't, a lot of people, how do we get them to be sort of an unbiased group, knowing that many of them may serve organizations that are applying for grants?
Sure. We do ask that everybody that goes through the grant reviewer sign a conflict of interest and confidentiality statement. I do have several reviewers that, will say, once they get an application, they will say, I have a conflict with this, and what I will do during the process is I will redistribute that application to another reviewer. And so some of those applications get shuffled around during that review process to make sure that if folks have basically any sort of potential or what could be looked at as any sort of potential conflict of interest or financial interest, that those are outlined in our conflict of interest statement, and then they self-identify, don't ask what it is, and just say, great, no problem, we'll redistribute that to somebody else. So.
Great, thank you. I'm glad there's a process, and, this happens just in a lot of, you want the subject matter experts, and they are also identified with things. And then just one last thing, and then I'll thank you, Mr. Chair. I noticed that there wasn't a lot of winnowing down from the subject matter experts to the executive review. Is that typical? Do you want them to sort of sort those out? Because then it seems like the executive reviewers still have a lot of applications to look through. Are there hopes that those get more winnowed down, or you're okay with the process as it stands and that many applications moving forward into the executive review?
Yeah, that's certainly something that we can take a look at moving forward. Historically, they haven't whittled down too much. I mean, you have to get all three reviewers to say, don't recommend for funding. We could increase that to say, 2 out of 3, and that would certainly cut down a few more from moving forward. So we could look at some of those things and decide what we want executive reviewers to see. If we want them to see more, because there's some potential in some, if they were to, recommend some partial award for some part of it, but not the whole thing, there's opportunity for that. But yeah, we could certainly.
I'm not saying it's broken. I'm just
Yeah.
saying that it puts a lot of burden on the executive review team to make some really hard decisions.
Yeah.
And could some of those decisions be made earlier in the process to make sure that, there again, I'm not questioning the process at all, but I'm just saying, do we need to make harder decisions earlier in the process so that all those decisions aren't left to the executive review team?
Yeah, I think that's a great recommendation. As we've been seeing the trend of applications really go up, we haven't changed that process. So I think being able to do that earlier in the process would certainly help if the trend is continuing to go up like that. That would be a great thing to do.
Thank you. Commissioner Shattuck McNally.
So I have a couple of questions. First one is, when we talk about, and I know there's a targeted and responsive, as you know, I've been digging into these for weeks now. So I'm curious about is there some overlap between the responsive and the services in diverse settings? You know, like it's kind of a similar kind of group of outreach. Would that be, so how do we distinguish between those two?
So these are distinguished by the applicant themselves, unless BHF staff feels like it could, be moved in one category or another, in which case we've moved, I think I moved one of them this year that was in responsive, that was for a school district that should have been in the child and youth services. I think there's a lot of overlap with some organizations that maybe don't fit one, but fit 3 or 4 different categories, and so they're just kind of in that responsive bucket because they don't fit necessarily in one or another. And so, again, that will be part of, I think, taking that deeper dive into what are those maybe primary, secondary, tertiary areas. Maybe it's checking more than one box, and maybe we consider that in the future of, are you checking more than one box here, and is that good or is that not good? Is it better to be focused on one? Is it better to, be touching base on all of them? And so those are things that we can consider as you kind of look into these as well.
Well, I'm glad you said that. That kind of segues to my next question. Knowing some of, since I've had a chance, like I said, to look at these with being the chair of the policy council, et cetera, there are several of these that are pretty complex and comprehensive kind of applications in some ways, because they are checking a lot of boxes inside. So does that make that application a little harder for the reviewers as they're looking through, and how, because some of them are very, targeted, and they have one area, but some of these are organizations looking for funding. Of course, this is funding everyone wants to get, but I just feel like do they know to maybe add more into it? So, what I'm saying, are they adding things in or to make it look like they're doing a wider group or wider sense, or can you tell from the application that it's really geared towards this? Does that make sense? Am I making sense?
I'll see if I can try to answer the question if you still have questions. I think it's complex because these are program project specific funds, and the organizations do a whole lot more outside of the one piece that we're funding. So although the organization might be doing a lot of this, the application itself or what we're looking to fund might be really specific to one or two of these things, or it might be asking for a piece of doing a whole range of things. So it's challenging to look at whether are you evaluating the organization, or are you evaluating the particular program project, which is this is funding. So it's a much smaller piece of the overall business. I think there was another piece to your question I wanted to answer. Can't remember what it is now, but something about the responsive categories and fitting a lot of areas.
Yeah, I mean, we have the responses, which is supposed to be for things that are not quite fit
Yeah.
those target areas. But I could see some of those serving in diverse settings could also be in the responsive. So I'm just, curious if that other responsive category is kind of.
So we have the goals for those targeted areas outlined on our website. And so if the project is primarily serving the goals of that area, that takes primary over some of the other ones, and that's kind of how that's been defined. But yeah, we could tighten that up in the future.
And then, I know it's a big trend, and it's kind of the popular trend. Also, there's data showing that it's effective. But when we talk about data-driven kind of programming, peer-to-peer programs, especially, there's tons of new ones popping up all the time that are maybe not officially 501c3s and things. So what kind of metrics do we look for, or what kind of metrics are those organizations looking to show or share for us to track that these are being effective? Because, I get a lot of questions from other folks about what does that mean? What does it do? How are you tracking outcomes from there? And is it, I'm saying it's other than just you saw 100 people. I mean, you could throw one event and saw 100 people, right? So how are we tracking if these are effective or having a greater input than just, helping them have some events to bring people together, which is important work, but,
Sure.
We have to still kind of show that it's making a change in the community, if that makes sense.
Yeah, so I think our application kind of walks grantees or applicants through that process of not only identifying outputs, but outcomes that they're looking to measure. And they have a couple different questions on the application to talk about how they're going to evaluate their own programs. And that's part of the evaluation criteria is that the capacity aspect of do they evaluate their program? Are they doing any sort of measurement, pre-post surveys, things like that to measure the efficacy of their program? So there is a specific question on the application for those to identify what they're doing to do those. And a lot of organizations are, or you can see that they're starting to, or you can see that the question has made them think, ooh, we're not really doing that, and maybe we should. For those that are reapplying for a continuation grant, they do have an extra question on the application to demonstrate progress towards the previous grant objectives and any outcomes that they're coming up with. Those are part of the interim and final reporting as well for the grant program, and so they have to identify in order to try to get awarded again to show that they are demonstrating efficacy. And so we try to pull that information from those, not just the application, but the interim and final reports for some of our outcome reporting that we do.
Tremendous work. I'm in a lot of meetings with you between the opioid abatement and the policy council and all this, and I know this is, I just want to say this for the public mostly, but I want to commend you all because this is tremendous work and a lot of work, as you mentioned, how many hours our volunteers are doing just to go even review all of these. And we have a process, it's a pretty robust process, but it takes a long time. And I just hope folks know, understand the amount of coordination and time and the process and following that and trying to be responsive. And you really try to help folks along the way from day one to answer questions. And I know you send out emails to over 600 people, and it's like a reset every year. There's not things that are left over. It's a reset every year, and you send out over 600 emails. We're getting all these folks back, and we have, I think you said, I had to change my numbers because I think it was more than I thought, less than I thought, but about almost from beginning to end, we're getting close to 50 people that have overlooked this, and that's a lot of eyes. And I just want to reassure everyone what we keep continuously improving this process, but we're really trying to be very accountable, transparent, and make sure this is getting the money in the right places to do the best good. And I just want to thank you all because I know this has been a lot of work this summer, so thank you.
Thank you, Commissioner. I will defer my questions in light of the time. Respectfully, I'd like to get through the next few slides as succinctly as possible so that we can focus our attention on the actual recommendations, the proposed recipient organizations, and we need to be somewhere across the street by noon, so please take that into consideration. And I offer that with a lot of respect and a dash of love.
Yes, sir. Okay, moving on. The next slide is the funding recommendations portfolio. So basically that bar chart of the awards, but put in a pie chart so you can see it all together. And you can see that the recommendations are in 82% of those targeted areas. So 82% of the funds are going towards those targeted areas. We do have a specific question about geographic reach in the application, and so just want to show that here and what that looks like, how organizations have identified their reach in the community. So most of the organizations that we fund are part of either Fort Collins, Loveland, or Estes Park. We have a couple that reside in Windsor, but majority of them are in those major city areas. And this is also self-identified information from the those applying. Most of them serve Larimer County, not just the areas where they happen to have their office and do a lot of virtual and hybrid offerings and are actually specifically doing targeted outreach to these areas. So just want to make sure that that was highlighted for you. In terms of the funding recommendations portfolio, we have all of those printed out for you to take a look at. All the recommendations are in this large packet, but I do want to just highlight some of the new grantees that we're bringing on board this year. because they are new organizations that we have not funded in the past. And so just a little information about A Little Help. Their focus is on older adult mental health to help decrease isolation for older adults, doing a walk and talk program and a 30-day call system in Fort Collins, Loveland, and Berthoud. We have Bloom Counseling and Nutrition. They are focusing on eating disorders and treatment specifically for low-income adolescents, both group and individual therapy. We have Colorado Artists in Recovery, and they're going to be hosting workshops and monthly events up in Estes Park. So workshops in Fort Collins and Loveland, adding monthly events up in Estes Park for leaders who are also in recovery. So it's a peer-led program and with a focus on LGBTQ+, and hoping to double their programming here in Larimer County. Finally, Home. This is a partial award for mental health scholarships for foster, adoptive, and kinship families. We have Rocky Mountain Equality, and that is focused on LGBTQ+ services, so therapy, case management, pro-social activities, and that was a partial award as well. The BIPOC Alliance, no cost, culturally sensitive healing methods. They're going to be doing events once a month. It's going to include childcare and hopefully decrease. They have an apprenticeship program, so again, something that is embedded in this but is not part of the workforce, and doing events throughout the county. And then we have the Jacob Center. So they're going to provide no-cost counseling program and trauma therapy. So they focus on trust-based relational intervention, the TBRI training. It's an evidence-based program for marginalized youth ages 10 through 14 and their caregivers. So those are some of the highlights from some of the new organizations we're recommending to fund for this year, as well as some new programs. So these new programs are organizations that have been awarded previously, but again, the program has changed, and they might have been awarded in years past, and maybe not necessarily last year. We have a couple on here that were awarded previous years, but not necessarily last year. So we have CASA of Larimer County. So again, another organization doing trust-based relational intervention, TBRI training to caregivers, both in English and in Spanish. They do a lot of court support for children and youth experiencing maltreatment. We have Every Child Pediatrics, and they provide integrated behavioral health and mental health services at Centennial High and Lincoln Middle Schools, and they target their outreach to McKinney-Vento students and newcomer students at Lincoln and Bolts Middle Schools, so those that are at risk or who might be homeless. We have Larimer County Community Justice Alternatives. This was a system integration proposal this year to help do a data sharing platform with a bunch of different groups that they had listed in their proposal with a lot of different letters of support, all looking to be on board with the systems integration proposal and data sharing proposal. We have Poudre Valley Healthcare. This is the Family Medicine Center specifically. We've BHS funded Family Medicine Center, but not since 2019. So this is kind of a new program, but they haven't been funded in a while. They haven't applied in a while. This was for a behavioral health needs assessment evaluation to help guide future initiatives for integration with primary care, and that's one of the goals for our child and youth care setting. We have the Matthews House. This is one of the organizations that actually submitted 2 applications. This new program is one, it's actually being nominated for our Gary A. Darling Award in the Alternatives and Interventions in Criminal Justice category. They're going to look to expand their parent cafes, case management, and evaluation for parents involved in the criminal justice system. So that was that. And then they have the Turning Point, which is a little bit of a continuation, but mostly new programming. They want to continue some of the addiction counseling services they have there. It's an intensive outpatient program, as well as blend in some new programming they call a Renew and Restore program. It's for women in the Larimer County Community Corrections Program, and adding virtual intensive outpatient options to reach those outside of Fort Collins and Loveland. So those are some of the new programs. Again, as a reminder, for folks that might not know, we do have a special nomination in the Alternatives and Interventions in Criminal Justice category for Gary A. Darling Grant Award. And this was established, I believe, in 2020. The first year was only $50,000, and it was a separate application. And then we decided it needed to be at the same threshold as all the other areas, and didn't require a separate application. We didn't want people competing for and having to apply separately through our grant program, and wanted to streamline that process. So now it's just nominated to the best application and in that category. And this year was for the Matthews House. And this was to honor Gary Darling, who spent his career in the behavioral health and community criminal justice system and helped get this ballot initiative passed. So I want to make sure we have time for questions. Again, you also have with you, this is the longer, more detailed one that has kind of a quick summary of all the organizations and what they were requesting funds for, whether they were a new continuation, the amount requested, the amount recommended. So it'll explain to you whether or not it's a full or partial award and give you a little bit of rationale on why that is. So that is that more detailed handout. And then we also have the quick, easy one, two-pager, I guess, front and back of all the award recommendations by those targeted areas.
Thank you. Thank you, Jessica. Well done. Colleagues, I think we have a couple of minutes if you have any questions, comments, feedback. Commissioner Shattuck McNally.
Again, I appreciate all the work you put into helping us sort through all of this, and that includes Laura and Amy, everyone on the team. It's just tremendous to help us. I'm curious, and it doesn't have to be done today, but I would just like to request, I think, I'm really thrilled about the geographic reach with this and getting to the whole county. I think this is one of their more biggest reaches we've ever had, and I would love to have, if we can, just kind of, I know you have it probably somewhere, the years past. I think, and correct me if I'm wrong, but I think this is probably the biggest outreach we've had with the most amount of municipalities or other groups, and I just wanted to confirm that, but also if I could get the data to show how we've kind of increased that over years, that would be great. Thank you.
Yes, I believe we have that from 2022, and so now we can start showing trends now that we've had that information for 3 years, so we can get that information to you.
Thank you.
Thanks, Commissioner. Commissioner Stevens, anything you'd like to add? And I'll see if there's time for me.
No, I think I'm good. I just appreciate the work and, the details around why you chose folks and what these organizations plan to do with the dollars. So I always, I think in looking at the different areas that you're funding, you've looked for gaps in the community. I think we'll probably, there may be more gaps considering the Summit Stone, most recent announcement. So for future years, it's probably something we'll see where those gaps end up. But I thank you for the work, and that's it for me. Thank you.
Thank you, Commissioner. I know our county manager has, let's go to the county manager then. First shall be last. What does that say? I'll see if there's time for me. Lorinda,
Really a
please.
quick one. You all are recommending to increase the awards to 3 million, a little over 3 million this year, especially with the 155 being put back into the fund. Are you comfortable with the fund balance, what that does? I know you're not asking for a long-term increase, but for this year, that's your funding. You're comfortable? Yes.
Yes, we are.
Okay,
Yeah,
thank you.
thank you.
So, thank you, Lorinda. Regarding the slide that is entitled Next Steps, I think the direction we want to offer is to have this on the administrative matters agenda for September 3rd for potential approval of your recommendations. And the second question is discussion item or consent. I submit that this is important enough that it should be a discussion item. That's do my colleagues agree?
Yes.
Yes, I think this is important for the public to hear. Thank you.
And then I have three questions. We'll see if time allows. Otherwise, I can follow up with Laura or Amy. My first question is regarding the evaluation, the grant evaluation process. And you did a great job of articulating all the hours that are involved in the individuals and the organizations. How do we thank all of these reviewers? Is there something tangible that we do? Do we buy them lunch? Do we give them a pat on the back? How do we support and thank the folks who put in a fair amount of time?
Great question.
That's my first question.
This year we did, I hand delivered a lot of swag with our new director as an opportunity to also have a lot of those grant reviewers meet Amy for the first time. But we've always mailed out either a gift, and we actually had them choose different colors of things that they've wanted today. Some Yeti mugs that have BHS logos on them. And so we have some nice gifts, and then those gifts have varied over the years. But and with a nice written thank you card, and
We may want to consider perhaps a thank you letter from the commissioners that might elevate it, because we value the work. So that's just one suggestion. A second suggestion on that one, Jessica, is it's quite possible that not everyone embraces swag things. So I hope you'll give consideration to other ways other than items that we could think about to, thank folks or honor folks.
yes,
Yeah.
lunch is an alternative option. We've done other gift cards in the past and have done other things besides that. This year, it was very popular last year, so
Okay,
we
excellent.
decided to do that this year. But
Then if I may, my second question is regarding the definition of subject matter experts and those three individuals, I think it's three, or there more?
for the executive review,
Oh, there are 22.
Oh.
How do we define subject matter experts? Does that include folks with lived experience who may not do this as professional people with a job in this area? I'm directing it to these folks. I'm hoping, because we only have 5 minutes or 2 minutes.
yes, we do include folks with.
I'm sorry, I can't hear you.
I said yes, we do include folks with both professional experience and lived experience on that review panel.
Okay, and then if my last question, thank you, and my last question is this, it's not sure if it's a good idea, but has there ever been any consideration for having some dollars set aside for some kind of, as an emergency response fund or something along those lines? What comes to mind is the recent layoffs of people from Summit Stone Health Partners. I don't know if that's a good idea, but or for example, people that are, I know we have our recovery folks and there's a lot of work there, but, could we or should we dedicate any funds for, after a wildfire like the Alexander Mountain fire, to help with anything? So, and perhaps some kind of emergency response fund, not knowing the logistics of that or if it's a good idea or not.
Thank you for that suggestion,
Just
sir.
a-
We'll certainly talk about it and understanding some of the history, how BHS dollars were used in the pandemic, post-pandemic. I think there's some opportunity for us to look at a model that we could bring forward in terms of a recommendation, but certainly do some research on that and circle back with you. Thank you for the recommendation.
Thank you. So I think if it's all right with everyone, it's 11:55. You outstanding job again. Thank you. We'll adjourn at 11:55 a.m.